Today we are going to talk about the bone that is the sternum. Now the sternum, first talk about the location. It is located in the thoracic cage. It is present in the midline. There is no right and the left sternum. Only the single sternum is present. Now the parts of the sternum. This is how it is located in the anatomically positions. Now this sternum is divided into the three parts. This portion is known as the upper parts. This is the middle, and there's the tip which is broken here. That portion is known as the lower part. Now the individual name has been given for this part. The one which is present in the upper part, this portion is known as the manubrum sterni. Then comes this whole portion. This portion is known as the body of sternum. When you move downwards, there is a tip-like process that is present. This tip-like process, this is known as a gypoid process. Now, this manubrum sterni is almost quadrilateral in shape. It's considered of this manubrum sterni get articulated with this body of the sternum, and there's the joints. This joint is known as the sternal angle. It is also known as the angle of Lewis. Now this manubrum sterni consists of the notch. Superiorly there is a present of the notch. This notch which is present, this notch is known as a suprasternal notch. Whereas laterally there is a present of one more notch that is present. This notch is known as a clavicular notch. Now this whole portion of the sternum is known as the anterior surface. This is the posterior surface, and the two lateral borders that is present. This is the two lateral borders. Now in this lateral borders there is a present depression. This depression is known as a facet for costal cartilage. The costal cartilage get articulated in this area. This area is known as the facet of costal cartilage. Now in the manubrum sterni there is a present of one facet that is present. This facet is known as a facet for first cartilage. Then when you move on to this area, this is the sternal angle. It is the junctions between the body and the body and the manubrum. And there is a presence of the costal facet which is present here in this sternal angle. This is the second costal cartilage. Now this manubrum sterni and the body get joined together and form a sternal angle. The angle it is formed by is the 163 degree. When you move downwards, there is a present this area which is known as a body. This body get articulated with this area. This part is known as a gypoid process. Now there is the joints in between the body and the gypoid process. This joint is known as a gyposternal joints. Whereas this sternal angle is the secondary cartilaginous joints, whereas this gyposternal joints is the primary cartilaginous joints. Now in the lateral you can see there is the facet. This is the facet for the articulating of the costal cartilage. Now this is the gross part of the sternum. Now the importance of this sternal angle, the muscle that get origin and the insertion, you have to go to the part 2. Thank you.